بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. أنا شاهد بن سليم، طالبة طب في السنة الرابعة، وفي هذا الفيديو بإذن الله بتكلم لكم عن Acute Kidney Injury. So what is acute kidney injury? Acute kidney injury is a sudden and often reversible deterioration of renal function, usually develops over hours or days, accompanied by a reduction in urine volume, which is called oliguria, and rising in serum urea and creatinine. في classifications كثيرة للأكيوت كيدني injury، بس أهم شي تعرفونه اللي هو ارتفاع في السيرم creatinine concentration بمقدار أكثر من أو يساوي 26.5 micromole per liter, which is 0.3 milligram per deciliter within 48 hours. طيب, what are the subtypes or the causes of acute kidney injury? We have pre-renal, renal and post-renal. Pre-renal يعني أي شيء يؤثر على perfusion أو blood supply of the kidney، ويكون السبب قبل الكلية، يعني أي شيء يؤثر على القلب أو الأوعية الدموية. Renal, when the primary insult affects the kidney itself, either the glomeruli, tubules or vessels. Post-renal, obstruction to urine flow at any point from the tubules to the urethra, either by stones, tumor or lymph node enlargement. So let's get started with pre-renal acute kidney injury. As we know, a reduction in perfusion leads to a reduced glomerular filtration rate. And if the insult is not corrected, this may lead to renal injury, most commonly acute tubular necrosis. In acute tubular necrosis, the dead tubular cells may be shed into the tubular lumen, leading to tubular obstruction. And because the pre-renal acute kidney injury is caused by hypoperfusion, usually it is managed by prompt fluid resuscitation. Moving on to the renal acute kidney injury, it is either caused by nephrotoxic drugs such as NSAIDs, proton pump inhibitors, ACE inhibitors or ARBs, which are angiotensin II receptor blockers. فمثل ما نشوف عندنا بالصورة على الجهة اليسار، نلاحظ ان الانسيدز تثبط البروستاجلاندينز اللي تشتغل على الافرنت arteriole. طيب, what is the effect of prostaglandins on the afferent arteriole? It keeps the afferent arteriole dilated, which is required for the blood supply and perfusion of the kidney. So when NSAIDs inhibit the prostaglandins, the afferent arteriole will no longer be dilated, and this will affect the perfusion and the blood supply of the kidney. On the other side, the right side, we notice that ACE inhibitors and ARBs inhibit angiotensin II, which works on the efferent arteriole. Like, what is the effect of angiotensin II on the efferent arteriole? It constricts the efferent arteriole, which keeps the blood in the capillaries that are supplying the kidney. So when ACE inhibitors and ARBs inhibit angiotensin II, the efferent arteriole will no longer be constricted, and this again will affect the blood supply and the perfusion of the kidney. Renal acute kidney injury may also be caused by any disease affecting the intrarenal arteries and arterioles, as well as glomerular capillaries. طيب, نبدأ بأول مسبب من مسببات renal acute kidney injury اللي هو acute tubular necrosis. It is caused by sustained underperfusion and reduced renal blood flow of renal tubules, leading to tubular cell death. It is also may be caused by nephrotoxins, causing direct injury and cell death in renal tubules. النفروتوكسينز ممكن تكون أدوية معينة أو مثلا الصبغات اللي تستخدم في الأشعة. The hallmark of acute tubular necrosis is the presence of muddy brown casts in urine analysis. The second cause of renal acute kidney injury is acute interstitial nephritis. It is an immune-mediated disorder characterized by acute inflammation affecting the tubulo-interstitium of the kidney, and it is commonly drug-induced. The most important clinical feature of acute interstitial nephritis is the presence of white blood cells and white cell casts in the urine. For investigations, usually renal biopsy is required to confirm the diagnosis, and for management, withdrawal of the offending drug is usually efficient for the kidney إنها ترجع طبيعية, but high dose glucocorticoids may accelerate the recovery. The last cause of renal acute kidney injury is glomerulonephritis. Again, it is immunologically mediated and it is characterized by glomerular deposition of antibodies, immune complexes, complement and fibrin. And the hallmark of glomerulonephritis is the presence of red cells and red cell casts in the urine. طيب كيف نعرف إذا acute kidney injury is pre-renal, renal or post-renal؟ إيش investigations اللي نسويها؟ For pre-renal, it is diagnosed largely on clinical examination, and the volume status of the patient is the most important indicator of pre-renal acute kidney injury. Bladder outflow obstruction should be ruled out by clinical examination and ultrasound. Other investigations such as urine analysis, urine microscopy, particularly for red cells and red cell casts, which are indicative of glomerulonephritis مثل ما ذكرنا في الشريحة السابقة. Also, we do urine culture to rule out any infection, and the urine should be tested for free hemoglobin and myoglobin. Other causes of acute kidney injury, we have rhabdomyolysis, which is the release of intracellular myoglobin, which is a direct tubular toxin leading to acute tubular necrosis. It is caused by trauma, compartment syndrome, or excessive exertion. Also, we have tumor lysis syndrome, when the treatment of any tumor triggers a massive breakdown of tumor cells, leading to increased serum levels of urate, potassium and phosphate, and secondary hypocalcemia. Urate deposition in the renal tubules can cause renal failure, which is called hyperuricemic nephropathy. This concludes the lecture of acute kidney injury. إذا حابين تستزيدون أو تقرون أكثر في الموضوع، هذه المراجع اللي استخدمتها اللي هي ديفيدسونز and كومار. وإذا عندكم أي أسئلة تقدرون تتواصلون معي على حسابي في تويتر، ويعطيكم العافية وموفقين جميعاً.